Welcome to the Dubai Docs Diary show here, where we speak about doctors that build really careers in the Middle East and have a breakthrough with their success in clinical, professional, and reputational success here. And today I have Professor Dr. Tamer Said Salama, an experienced surgeon with experience in general surgery, laparoscopy surgery, particle surgery, and of course, healthcare quality excellence. And this episode is for those who wanted to know a little bit more about this profession, being a doctor here in Dubai, what it takes to not only be successful, but also stay successful. And we have the really backed and proof here with Dr. Tamer Said. So happy to have you here. And for those who meet you or see you the first time in this podcast, explain us out of your point of view, what are your specifications?
Thank you so much, Angela. I'm so happy to be with you today, and thank you for this amazing introduction. Yani, it was very nice of you. See, I'm Dr. Tamer Salama. I'm a consultant of, as you said, of laparoscopic and general surgery. I'm the head of the Center of Excellence. I'm honored to be this. 3 Center of Excellence and one of the biggest private hospital in Dubai. Center of Excellence for bariatric or weight loss surgery, and Center of Excellence for minimal invasive surgery, and the Center of Excellence for proctology surgery. And to be honest with you, it was one of my strength point or one of my broad point, because it's the first time in UAE for a general surgery department to have this 3 Center of Excellence or 3 specialty at the same time. This is one of the most point I'm proud of.
Wow,
yeah.
that sounds very like you invested a lot of dignity and work into your career. And let me just jump right to the beginning. Yeah. How come that you wanted to be a doctor in the first place?
See, I will tell you something. I'll tell you from the start. See, I'm coming from a family who most of my family, like my father, mom, and even my uncles are physician and they are surgeons. So I grew up in this career. I grew up in this field. Honestly, Angela, I grew up in a field who I see how taking care of the patient is very important, how it can affect human life, how it can make even our family life like happy or not happy, changing our schedule, going out, not going out. So I grew up in all of this. Yes. I believe this is one of the most important point which put the cornerstone for my character. What the second question is, why surgeon? This is, see, surgery I believe is not a career. Surgery is identity. Surgery is a character.
Oh, you said this so beautiful.
Yeah, I'll tell you something. I always say that to my audience and then my social media. When you saw someone who can take a fast, rapid decision under pressure, mostly he's a surgeon. Mostly he's a surgeon.
Mostly he's a surgeon.
Yes.
I bet I would have become a right good surgeon, because this is a quality that I'm always looking in people. Can they do fast decisions?
Fast, no, it's not only fast, rapid decision under
the pressure. Very good.
You imagine this. With every time you grow up, with every time you mature, you realize the value of that someone is coming who don't know you, he don't know anything about you,
yes.
And just he come by his own decision just to put his life or put his neck or whatever under your knife. It's not easy, Angel. It's not an easy.
Yes.
I believe this is the most difficult agreement between two bodies in the life.
Wow. Yeah. Wow. Yeah. You put it this so beautiful. Thank you. So you came. Was brought up in an academic family, so it was not so far-fetched that you had to go also to university. You studied, I believe, in preparation in Alexandria, right?
No, I'm a professor in Ain Shams University, which is one of the biggest university in the Middle East, and it's ranking worldwide. You are very smart, so I will tell you, because this was the second cornerstone in my life.
Okay.
If sometimes God put in you a stones, you go through a pathway.
Yes.
You don't know the end of the pathway, but God knows where we go.
Yes,
So
yes.
this is one of the biggest university and the most strong university in the Middle East. Till now, I remember everything my professors and my colleagues taught me. You know, the first colleague who catch my hand and put to do the first surgery, I will never forget this moment. Yeah, you know. So I believe, yes, the university was very important during this period to make part of my character or part of my career now. Yeah.
Yeah. But so you studied here in Dubai. Did I understand this right? Or you studied in Alexandria on the university?
No. In Shams University is in Cairo, in the capital. Okay. So if you ask me 10 years back, you are going to work in Dubai, I will tell you, why?
Yes, that's what is actually my question leading to why Dubai.
No, it was very far from my mind, and I was working very nicely, good. I'm a professor in the university, I have a lot of patients, but most of my patient was coming from the Middle East and especially Dubai.
No way.
So they were coming to me in Cairo to do the procedure. I was doing like 20 to 30 procedure per month, which is a huge number. Then when COVID happened and lockdown happened, I found that I should take a decision because, you know, all of my patients were stuck though. I'm stuck in a place and they stuck the place. Okay. So I should take a decision and I should take a step further. By matter of luck, I found till now I didn't decide to go to Dubai or where. I found a call from one of the big hospitals here in Dubai. They tell me, Dr. Tamer, we were following you for the past 2 years and we need you to build up the first center of excellence for weight loss surgery in our hospital.
Wow.
Yeah.
And we all know what hospital that is. Yeah.
So, you know, this is what I'm telling you. Every moment when you feel that what is my next step, just relax and wait. God will open the window to you.
Yes.
Just pass through it. So I told them fine, and I came. This was like 2019. Okay, 9 months after I came, I accredited with them by the first center of excellence they have. My first patient, which I did for weight loss surgery here, was 220 kilogram, which is
huge.
Yeah. Year after, another hospital, they call me and tell me, Dr. Tamer, we need to open a new center of excellence. And I started back to move this hospital, which is still working for 5 years now. And we did all of this achievement or all of this center of excellence. Yeah.
Very good. Very, very interesting. So tell me a little bit, what is in your first steps that you came here? Well, you was in a very good position that they have asked you and went after you because you had your reputation already built it up in your home country. But what was the most challenging part of coming here and start working? Where were the biggest differences? What you know from your home country?
See, let me tell you some tips and tricks for my young colleagues, or even for any colleague who want to take this movement or take this step. First of all, if you believe in yourself and if you believe in your talent, it will not make a difference wherever you're working. You are talented. This is a part of your personality.
Exactly.
So to reach the top in a certain place, and you take a decision to start to repeat it again from in another place, don't be afraid, because I see a lot of people who said, I'm going to start from zero in the...
Yes.
No, my friend, no. You are talented. This is part of your character. You are going to copy-paste what you are talented to do. So what I'm doing here, it's the same what I did in Egypt. It's the same where I'm going to do, the part of my character. So first, don't be afraid. This is number one. Number two, the movement itself, it gives you passion. It gives you another reason to succeed. Sometimes when you reach, you do everything in a place, so with every success, it becomes more difficult to have a new target or a new success. So if you feel that you reach the maximum or the top in a place, take a step to another place and
Yes.
repeat what you're doing. This is
Yeah.
self motivation. This you build up a new reason
Yes.
why you are doing this.
If you are the biggest in one room, you have to change the room, right?
That's it. Yeah, yeah,
So,
yeah. With a more larger room. This
Yeah.
is very important.
Yeah,
Yes,
yeah,
I agree with you. So this is the second type. Third point, Dubai is a multicultural city. So it's a very challenging city. Let me tell you something. A lot of people think that Dubai is like only the heaven. You come here and stay, you sleep, and you go up in the morning, take your salary, and that's it.
Yeah.
My
Go to
friend,
beach and
my friend, this is not Dubai.
Yeah,
This is not Dubai.
Yeah.
Dubai doesn't accept with the average people. If you are not talented, if you are not strong, if you are not
willing.
yeah. If you are not one of the top, you will not survive in Dubai. You will take
If you're not willing to be one of the top. No?
100%.
Yeah, yeah.
If you don't know what's your step, if you don't know how to put your fingerprint, if you don't know what you are coming to do, يعني even you don't have time to just, I will give me a little bit time to think what I'm going to do. No.
Yeah.
Dubai doesn't accept with the average.
Yes.
Dubai need only top people.
Above average.
But I will tell you something. To be honest with you, it's fair. If you are talented, you are going to take your position, which is very important. Yani, you are working and you know that you're going to reach what you deserve. The something, the position you deserve it. So this is Dubai. You are going to work, you have the experience, you are going to be talented, and you are going to be a hard worker. You are going to take your position, they are going to put you on the top. That's it. So Dubai definitely is a good opportunity for anyone who trusts himself and need to reach a certain position.
Yes. I find regarding that, the quote of our Sheikh Mohammed very good. He always says, whether you are a lion or a gazelle, if sun rises in Dubai, you better run.
Yeah.
And that is something that is always motivating me so much, because it doesn't matter in what position, everybody is so motivated here. And I think that's also the beauty of this place, that those people, doesn't matter on what background or in which position they are motivated here, because they cannot afford to not run when the sun rises.
They are very
right?
smart to motivate and to get out of the people the maximum. They are very smart in this, okay? And the second, which I said you before, they are fair enough that if you're good and if you are talented, we are going to put you into a position, which is very important. Sometimes you're working in a place, you are doing your best and you are one of the best, but you didn't take your rights, you didn't take your position, you didn't take what you deserve.
Yeah.
Which can go by the opposite, can suppress you, can make you unmotivated, okay? But here is not like this. Here, if you're good and you're running, you're taking to another step, they're with you.
Yeah, it's such a beautiful place also, where you are allowed to be successful, because I see it a lot of times in Europe. That's one of the major reasons why I left Europe, is actually because I always had to apologize to be successful, to be willingness to go to the next room, to get the next level. And that is something that I like so much about Dubai. So tell us, for your young colleagues who would like to come to Dubai, what would be the first 3 steps you would advise them to do?
See, when I come to Dubai, I was already consultant or I was already professor. So I came to Dubai from the big door. My first advice, some of my colleagues, they are come just after graduation and they want to need to come, and they said we can start in any job or any level, point of entry for any job. This is not good, my friend. If you start from the big door, if you go in from the big door, you are going to start from a big level and you are going to continue for a big level. On the opposite, if you start in a small job, you will take a lot of time and you need a lot of effort to go to the next step. So don't rush. Don't rush to come to Dubai unless you have a solid base.
Yes.
You are standing in solid land. Here I'm Professor Dr. Tamer Salama, who already did a center of excellence in Egypt. You got my point? It gave me a big advantage when I came here. So don't rush, make your solid base, invest in your education, invest in yourself until you are strong enough, then enter it.
I think also when it comes to your profession, this here is not a land where you train yourself to be good. You have to be already here when you are good, because also the number of operations, you have different timetables here in Dubai, I suppose. When I compare to Germany, they have like kind of so many operations on one day, then that's where you learn to be routined. That's where you learn your skills really to develop. And then you can come here in Dubai and be routined and be the expert that this market is looking for. Is that right?
I agree with you 100%. I agree with you. That's what I'm telling you. When you come, if you are coming and you are looking from the up position, will be much more better than looking from the from down to up. Okay, but I will add you something. Even if you are coming or enter from the big door, or you are a strong position or a big position, you should be malleable to accept the modality or the new technology which will be here in Dubai available. يعني Dubai, one of the most advantage of it, that you will, any new technology, they are open their hand to accept it. So even with the expertise you come, you should be able to accept these new techniques, this new modality. You should working on yourself, modifying yourself to be updated, to be always in this top.
Thank you for your insights. So when you came to Dubai then, and this hospital wanted you to work there, obviously they helped you along with the licensing process, data flow process, and all of these things. Can you tell us if you would have done this for yourself, by yourself, would it have been easy, or would you have rather had some guidance? Were you happy that they did it, or how was it? Tell us a little bit about
the first step for this finalized license and such points. I was supported by one of the company, which is I believe, and I suggest for my colleagues who want to come, is better because there's some fine details which we don't know it. And, which if someone is involved, it will be much more easier and much more faster. Okay, but because again, my background is coming from a university, this may facilitate a little bit to finalize all of my documentation. But yes, I was supported with one of the companies. Yes.
Very good. Yes. Yeah. So when you then had your license, started to work, were you surprised by the salary that you was offered in a good way, or would you thought like, the price model for my salary could have been better? How is it? I find always it's kind of a negotiation here where people in Europe have to, take what they get. Here you can also negotiate. And if you know you're good, is it also recommendable to be, you get a part of a commission of the things that you do, the operations that you do?
No, very smart, Angela. Tricky question. See, I will tell you something. My personality, what I'm going to say, I don't, it's not obligation for anyone, but I'm going to say what I'm doing and my way of thinking, okay? When I start working, my first concern, I just want to prove or say who is Professor Dr. Tamer Said. So I don't care at all with I never negotiate in my contract. You got my point? So the first point, I must speak about the first contract. I never negotiate about it because first point, this is your first enter to the country, and you didn't show what you can do and what everyone can speak. Everyone can say I can do. But on the reality, we don't know what's going to happen.
Very humbled. Yeah. I really like this quality. Very humbled. A lot of people, they are at this point then like a shark, and they just try to step into the door like what they did before in their home country.
No.
And you was just willing to put your ego away and say, okay, I'm humbled. I'm starting somehow not with my expertise, but with my repetition from zero. And that's what I have to take. Yeah?
No, I will tell you something. I should do my part first, and I should show you who I am and what I can do. Then by the end, the judgment will be for you. So again, for the first contract, I never negotiate. Let me tell you the point. And even after the first contract, the second and the third contract, I never ask for something. Khalas, already they saw what I did.
Yeah.
That center of excellence, my work, my expertise, what I did. So whatever they told me, which is more or less is fair enough for what I'm doing, I accept it and I do it. The good one and the excellent one, no, he don't need to negotiate in this. Prove yourself, do your best, and everything will go smoothly.
Very good. Very good. So, yeah, how is it actually then? Hospitals that really like you, clinics, can you also work with clinics and small centers?
No. No. Since I start working, I have some like pillars in my life. I work only on big hospital with a good reputation, who care for the patient life more than they care for the
revenue. Yeah.
I never work in place or accept to work in a place. They ask me about revenue. They ask me about the number of the patients. They ask me never happen.
Yeah.
So this is, I believe this is one of the cornerstone of my success, because I put outline for myself. I never go out of this outline. I use the best instrument for my patient. This patient can be my brother, can be my mother, and actually I did a surgery for my mother and my sister. I mean, you know,
here in Dubai.
No, it was in Egypt.
Okay.
But I mean, by the way, even in Egypt, I was using the top instrument.
Yeah.
The patient is a patient.
Yes.
The patient is a patient. Patient is, again, how I going to convince this person to put his life under my hand? This what I'm telling you now. This is what they convince him. This, when they come to me from any far city like Abu Dhabi, like Al Ain, they come because of this. We need Dr. Tamer because we know him. We hear about him. His reputation with our family in a case. This is what. So I mean. I only work in a big hospital with the best reputation, they care about the patient, and they have the best technology.
So I'm interested in, are you helping actually also colleagues, young students, to basically get their skills shaped up here in Dubai? The landscape of training medical experts, doctors, has been very much developed. And what part do you see this goes within the next 5 years? In what directions do you think we are entering in this 5 years? And are you a part of it?
Yeah, see, let me tell you. In Egypt, I was already a professor in university, medical educational university, so it was part. And here, I'm the one who established in my private hospital the general surgery internship in the program. So yes, we have residency program in our hospital, and we are upgrading them. Definitely, we have some difficulties. Okay, because we are the private sector. Okay, but we are working on it, and I believe. If you ask me about the future of the medical aspect in the UAE, I believe it will be very good. I see a lot of societies, which is like Emirate Society, for different specialties. They're doing a lot of good efforts to educate and to introduce a new technology.
Yes.
They are open-minded for the surrounding innovations. So I believe we are going to be the hub for the medical service.
I think so too.
Worldwide,
I think so too. Where the Middle East has been looking for centuries towards Europe and the West as such, for being having orientation in the health industry. I think it is about time, if we not even in the middle of it, where it totally shifts, where everybody is looking to the Middle East to get the orientation of technology, of education in the medical field, even of the experts. Because what I witnessed, and just I wanted to maybe have your point of view on it, I witnessed that there is a totally shift in the completely Middle East, as from Germany a lot of experts are coming towards the Middle East, and the whole system there is so much under stress because all the Syrian doctors are leaving Germany to build up their country. And now Germany does something very unsmart and even maybe smart. They think it's a smart move, but I found out that the German government is actually recruiting on the Egyptian universities for coming to Europe to work there as a medical expert or do their studies till the end. So finish it off, makes them having then some medical experts, where then is actually Saudi Arabia in the game, which has been for years actually recruiting on Egyptian universities and get their stuff, their experts from there. And now they found out that so many European really people who are already, wanted to deliver, wanted to be a good doctor, but not anymore agreeing with the system, with the politics there, and they're leaving. So the Middle East is opening up to all of these talents. I think this is something so beautiful, and for me, it's I'm so proud to be a part of it and part of this city, to witness this in front of my eyes. What is your witnessing, and what is your expertise in that? What do you think about the whole situation?
I'll tell you something. Let me tell you some number from us. I love statistic analysis.
Yeah,
I'll tell you some numbers. So, first point, due to a lot of circumstance around us, we are in a huge dynamic state. So a lot of change is going to happen worldwide. Yani, you are going to see a lot of reconfiguration for a lot of positions, not only in the medical field, medical and non-medical. So a lot of change is going to happen. Some are going, as you said, from European will come to Middle East. Some from the Middle East, from Egypt, Syrian, or will go to European to replace. So a lot of change. The world which you see in the past 10 years will not be the world you are going to see in the upcoming 10 years. This is first point. Second point, which is very important, by statistic analysis in my surgery, in my clinic, 70% of my patients are European patients.
Are they?
Yeah.
Wow.
And this is Dubai. This is Dubai.
Yeah.
You understand me? This is what I told you to start. What I mean, these people have their own expectation. They have their own requirement. So if we don't face this expectation as regard the quality, as regard the techniques, as regard the innovation, we are not going to win them. We are not going to take their trust. This is what I'm telling you. So the configuration of the nature or multicultural in Dubai put an impact or stamp on what we should do. If you are not on the top level as regard everything, you will not gain the trust of this population.
Yes, it is so true. Thank you for your seeings, and I'm so grateful that I see it on the same pattern somehow, and I'm very astonished that a lot of European clients patients coming to you. So how is it here with patients? How is it here to be a patient? In Europe, you have this insurance card that you directly cashier with your insurance, or with the hospital is directly cashiering in the insurance. How is it working here?
I believe this is one of the advantage in UAE as a whole, the insurance system, that they have a strong insurance system which cover 90% of the population. Yani by the law is not allowed to work or to have a contract without covering insurance.
Yes.
So most of the population is insured. Okay. But still we have a margin like 10 to 20% which is cash patient coming for vacation, coming and still in the beginning for the process of the finding their job. We also try to accommodate them by making like discounted offers, like reducing the prices from any point of view. And also this category, we try to accommodate as much as we can with giving the same service or the best service we give for the insurance patient.
Yes, yeah. But in generally, then you have actually no direct billing with the insurance, but the patient is prepaying and then they reimburse it with their insurance. Is that right? Or how is it working in a hospital?
No. The contract with insurance, everything will be the insurance. Everything.
Okay.
Only the patient pay like 5 to 10% according to his contract with his insurance. But in most of the cases, in 80% of the cases, we deal directly with the insurance. The patient just take his service and that's it. But some cases, as you said, especially for the international insurance, if his insurance not based on Dubai, it's based on another country, yes, this may happen. That the patient pay, but even if this happened, we also make agreement with his based insurance or back home insurance before we proceed. We should get like some type of approval. Especially in the emergency situation.
So that's very interesting, because it leads me to another question that I wanted to really have placed here. A lot of people, especially in your field, have the misconception that the age of the population is not high enough to have sort of these kind of lifestyle disease based surgeries, or even you mentioned weight loss based surgeries, that they don't actually exist so much here like anywhere else, because the population here is very healthy, health orientated. How do you estimate the population here? Is it a good base? You have enough clients, patients, or you work more on the prevention of your patients to prevent everything that they could suffer of?
See, what you are speaking about, this is speaking about the epidemiology of the disease
Yes.
in Dubai or UAE,
Yeah.
which is again because of the continuous change in the population type. There is a continuous dynamic change in this disease. For example, at a certain stage, there was lax disease, and the hemorrhoid was very common, and still is very common because of the spicy food, which is very common among the Indians,
Yeah.
and even among the Europeans who like to eat the Indian food. You got my point. At a certain moment, when the fast food was, there's a lot of campaign, and it was very common. The incidence of obesity was high, and we were doing a lot of cases of weight loss surgery. But because we are one of the top city for using the new medication like Monjaro and like so this type of surgery go down a little bit, and we start using the Monjaro. So I mean, even this is changing with the change of the new technology or the new medication or the type of population which is in Dubai. And that's what I'm speaking with you, because in the past some surgeon or doctors are used to do certain type of surgery, that's it, and we don't do anything else. When the bariatric surgery decrease, they stuck, because so what I'm going to do?
Yeah.
So again, my friend, you are a surgeon, you are a talented surgeon.
Yeah.
You are treating weight loss, you are treating the reflux, you are treating the thyroid, you are treating the hemorrhoid. So whenever they need me to support, I'm going to support.
Very good. Well, thank you, Professor Dr. Tamar,
Thank you so
to actually be here. Let me pick your brain. Shukran, Asante Sana.
Thank you, shukran.
It was a pleasure. So, little guidance for our clients. For our listeners, we will have the show notes filled with your contacts, but let us know where we can find you in generally.
I'm a professor and a consultant in Saudi German hospital. Anyone can, I'm happy to accommodate and to meet anyone in my clinic. طبعا the main branch in Dubai, and I have a big social media. You can share whatever you want.
Yes.
I'm happy. I'm replying the message and everything with my audience.
Very good. Thank you so much.
Thank you, Andrea.